that's one possibility as to why it is that I've had it. I would say out of all the foundation health principles that I do my best to follow, sleep right is probably the one that I have compromised the most over the years. And, you know, it's one of these things where, yeah, you know, if you don't follow your own advice, then it would come back to bite you. And I think there's loads of research that shows that compromised sleep.
What's your approach then to sleeping right?
So well, again, this is like, I think that the perfect approach would be to switch all your screens off and, you know, dim down the lights and so on in the evening. Make sure you get sun exposure during the day.
Before you go to bed, you mean? Before
you go to bed, yeah. Yeah, but for at least a couple of hours.
Yeah.
Really with the sunset is what you should do. But what I tend to do is use red glasses, which are blue light blocking glasses, and I tend to work quite late. So that's something that's probably suboptimal. It's probably better than a lot of people, but it's suboptimal. You know, I used to be of the understanding that you need to have 8 hours sleep per night, and then I heard Matthew Walker talking about, you know, everyone needs at least 7 hours sleep per night. So then I kind of whittled it down a bit. I don't know if you've heard of Matthew Walker, but he's this professor of sleep science at I think Liverpool University. And so, you know, I suppose what I've always done is I've always kind of rode the edge of what is considered allowable, and I probably should actually listen to my body a bit more in the evenings and switch off and relax and
so we're actually, although it's you we're talking about and your own advice, we are talking a little bit here about patient compliance, which is another added complexity in clinical practice. It's all very well us saying, not you, but it's one saying to a patient, these are the 7 things that you need to make sure are working perfectly, and 6 of them are really quite simple, but actually if they don't do it, it's not going to help.
Well, you know, I think there's always, what I would say is those are ideals, and so you can't exercise perfectly all the time because you're going to pick up injuries and you're going to have other commitments and so on and so forth, and you can't sleep perfectly all the time because, again, you're going to have emergencies, you're going to have parties. So it's always something that I think we aim towards, and in doing that we maximize our capacity for health and performance.